Hey, everybody. Welcome to the Santita Jackson Show here on AM 950 Radio, the voice of progressive Minnesota. It's a joy to be with you. And let's get right to it. Let's talk about deportations in the next hour. Uh, Young people some of whom are permanent residents, will be deported because they have been supportive of Palestinian rights. They've been called pro Hamas because they support Palestinians. Let's talk about that. And some Americans are being threatened. American demonstrators are being threatened with prison. But let's talk about the state of women's health in America. We have got a real crisis. And let's look at women, because in fact, we're really picking up on a series of conversations that we've started, that we are starting with Dr. Deborah Furholden, one of your favorites, and certainly one of mine, former Dean of Global Public Health at NYU. And of course, she is one of the world's preeminent epidemiologists. We're so honored to have her. She is a professor at NYU in that space. And she does so much. I first met her when she was an associate dean at the Michigan State University Medical School. But she's also very active in the community. And one of the things that's most impressive about you is that you're always helping us to understand you translate policy into language and into actionable items that impact our lives. And I think it's very important now because we are looking at threats to our health care, our access to it, our ability to pay for health care, with the threatened cuts to Medicaid. When Medicaid is unplugged, so will Medicare be unplugged. And then Social Security, they're looking at unplugging it. Those are the social safety nets. The wealthy people call them entitlements. Well, you're entitled to them because you paid for them. That's been pulled out of your check every single pay period. And when you pay your taxes, if you are independently employed, you have paid into a system that they're saying cannot pay you back. And Elon Musk calls them entitlements, and he calls it a Ponzi scheme. And yet he was just awarded a $400 million no bid contract from the Pentagon. The only government entity that he truly refuses to audit, although they have failed at least 7 audits. We've got to talk about this because now we're seeing that programs that support the people are being cut, but programs that prop up corporations are being let go. So let's talk about the life expectancy in the United States, which continues to drop to other high income nations. Let's look at why. Massachusetts, you can be healthy there, but in Mississippi, you can't be. In Vermont, you can be happy, but in Texas and Nevada, no. What about Black women and really all women in the United States? Why is getting pregnant and having a baby almost akin to a death sentence? These are things that you bring up constantly, Dr. Verholden. And so I want to know where you want to begin, because this is prompted by the fact that, we took a little tour and a detour in our conversation last week as we were talking about Social Security and Medicare and Medicaid. But then we just started talking about our health, and everybody said, wait, hold it. We need more. Because you made me start looking at, as you always have every time I have these conversations with you, you made me look at some things that I'm experiencing. And I said, wait a minute. And I was hyper conscious of them. So now I know what to tell my doctor when I see her and say, wait a minute. I thought that I was not feeling anything in menopause. You said, no, that's what brain fog is. I have never had a problem misplacing keys constantly, leaving hats and things leaving items behind. Well, I'm doing a lot of that. And so we've got to talk about that. And it makes me think, because I got a great grandmother who had Alzheimer's, right? And so I just want to make sure that I can keep my mind and all of that. Hey, Bernadette, like and share, like and share. Hey, Miss Zenobia and Velma, I want you all to like and share, and please go to Blue Sky. I heard from you. You all saw me at Roberta Flack's funeral on Monday, and what a celebration it was. It was one of those services that I absolutely did not want to go to, but I had to go. I had to go. And I did have some words, and you all received them in an overwhelming way, I must say. And I want to thank you. But she was worthy of the tribute. And so let's get right to it. I want you to meet me on Blue Sky at santitajackson.bsky.social, the Santita Jackson Show YouTube channel where you all are right now, the Santita Jackson and Friends Facebook page. Please get on, all of you on Facebook. Please pile on over here and like and share the show, like and share the show. And thumbs up, thumbs up, thumbs up, thumbs up, because I need us to help. You need you to help me with the algorithm. When you do that, when you like the show, you really help us to break on through to the other side. And of course, I'm still on X at Santita J. At Santita J. So let's get started, Dr. Deborah Furholden. Um, when you look at the state of the health of women and men, we will get to you, I promise. It's it's not as we're the richest nation on earth, still pound for pound, but we're not the healthiest by far. What is going on?
So the first thing is, I think women's health is men's health, and I think men's health is women's health.
Why?
Why? Because men have daughters, mothers, wives, sisters. Us understanding the unique challenges that you face as a gender are important. If you are a dad, wouldn't you want, and mind you, in an ideal world, dad, who has a daughter, also daughter has a mom and aunts and all of that. But I just think it's important, this idea that, well, that affects you, so not my problem, or that doesn't affect me. I actually think it's these conversations around women's health, especially women's health as we age, is a really important conversation for men to be in. Like when you said, I never thought about, or no one ever said to me that brain fog is a potential symptom of menopause. And it very much is. But can you imagine being partnered and your partner just thinking, oh, this is just cognitive decline or aging or like that? Because the second you can link the two together, there's also something that becomes available. But it's an interesting point that either you didn't have the thought to ask your doctor about it, or your doctor is looking at you and you are of a certain age. These are good questions that your primary care physician, your OBGYN or GYN, we probably don't need the OB so much anymore, but we need the GYN, right? Right? Those are important things. When my precious little sweet India was born, and this is where bias in our healthcare system becomes so important, which is why I think we all need to be informed. Your doctor is your partner in your health, not the master of it, not the leader of it. They are your partner in it. So you have to bring a certain amount of knowledge of self and just baseline understanding to make sure that your doctor is bringing forward what they're bringing, right? So India, one of a big risk for infants, children under 5 especially, so infants and toddlers, is whooping cough. And we all got a vaccine in childhood, and there is an adult vaccine schedule, and it's called Tdap, which is your tetanus, pertussis, which is whooping cough, and diphtheria. Women are supposed to get that when they're pregnant. All grandparents are supposed to get a Tdap booster if you haven't had one in the last 10 years, because grandparents are a big vector for giving it to infants. The symptoms tend to be milder in adults. Why? Because many of us have had the vaccine, or we've been exposed, we've got antibodies, but it can be really harmful for newborns. And then the risk decreases over time, but the likelihood of complications or even death is greatest for children under 5. So my doctor knew that I was having a grandchild, because when I found out I was going to be a grandmother, I would have taken out an ad in the New York Times if they would have let me. Everybody knew. And I talked about it at length with my doctor. And then I went to one of the final prenatal visits with my daughter, and it was her OB who said, "Grandma, did you get your pertussis booster?" And I said, "What are you talking about?" And he said, "You're supposed to get your booster shot because you are likely to be the one to give baby whooping cough." And I said, "Well, that's funny because my primary care physician, who I just saw a couple weeks ago, didn't mention it." So I call her up, and I had to come back for some follow-up results. And she said, her receptionist said, "Oh, we'll talk about it when you get here." So then I asked her a couple weeks later, and I did say, "Put this on, make sure you have it in office because I want to get this booster when I come." And she said, "Oh, well, you're such a young grandmother. I didn't think about it. I normally recommend it for people at 55, but I didn't, most people don't become grandparents at, whatever age I was, 47. And I was like, that is so offensive.
But
There's nowhere, and I look, there's nowhere where it says recommended for people at 55. It says recommended for grandparents. But she has her own, so she had the knowledge, but she also had some weird rule or rubric that had her not offer me what I needed to protect, at least to make the choice about if I wanted that protection for my granddaughter. So we just have to be knowledgeable, because these healthcare professionals, they know what they know, but they also have their own biases.
you know what? I'm going to tell you, I faced that with obesity.
Yep.
It took until I was almost 40 years of age, and I'd been obese really roughly since I'd been about 7. Well, heavy, chubby, and then that evolved into obesity maybe 10 years later or so. I had not been asked a series of questions that would have had that would have pointed to hypoglycemia.
Uh-huh.
It turns out I'm hypoglycemic. And I said, this is amazing that it's taken this long. And I had to go to a specialized doctor who knew the questions to ask, because he said, it's not that you are just eating, because the thing is, I wasn't. But what are you eating? And, it's just getting the sugar out of my diet. Oh, I mean, now I can have a slice and this and that and the other. I can have a little bit, but what galls me is that I wasn't asked a question, and I think that's why I wanted us to talk about this today, because we're not presented with information. So when we go to the doctors, we don't know how to ask. We don't know what questions to ask.
Yeah. Yeah. So
So
even, if these conversations just prompt people to ask better questions of their healthcare professional, I think that's important. And I think these conversations should be important for giving people access to what they could be doing independent of their healthcare professional in their own life. So these are important conversations.
Okay. Well, then let's start here. Tell me about life expectancy, because I think everything kind of comes after that. Why is our life expectancy in the United States dropping? And I mean, and is there a difference? Is there a differentiation between the life expectancy of men and women? If so, why is that?
So there is, and there always has been. And then depending on how deep you go into it, it starts to get even more nuanced. So I'll give you an example. So the big picture, we spend more money in the US per capita on healthcare than any of our peer nations. So we spend a lot of money, but we have a lower life expectancy. So you're expected to live longer than many of the residents in our peer countries. And it doesn't kind of go together, because you would think, well, we spend more money, but we don't get return on that investment.
Mm.
But it's also because a lot of our spending is after the fact. It's not focused on prevention, right? I kind of think of it as the sick care system.
Oh,
Really when it kicks in is when you're sick, and so treating people is one thing. Preventing people from getting sick is something different. The other thing is we have some of the biggest wealth inequalities compared to our peer nations. So what you'll find is the gap between the haves and the have-nots is gigantic in the United States. And we know that your genetic code is less impactful in many cases than your zip code and how long and how healthy you can expect to live. Where you live, the conditions under which you live, what you have access to,
yeah.
are primary drivers of how long and how healthy you can expect to live. And unfortunately, we have big inequality in the US.
But I mean, what with these proposed drawdowns on the social safety net, will that create a crisis, even more of a crisis than we're in now?
Yeah, I think what we've been doing is sort of satiating the crisis. And it's unfortunate because the insurance companies make money by taking in more premiums than they pay out in coverage, right? And so there's an incentive for them to save money. Prevention actually saves lives and saves money, but it's a right now upfront spending. It's easier to deny somebody a treatment on the back end than it is to do the work on the front end to either prevent them from getting the illness, or to identify them early enough where the treatment isn't as costly. And I don't just mean dollar wise. The longer you take to get diagnosed, the more disease progresses. And the prognosis, the outlook, how well one can do, the likelihood that you can fully recover changes over time. The best opportunity is to get people identified and managed early. So there's some things that are competing against each other. You've got hospitals who only make money when people are in the beds or in the rooms. And then you've got insurance companies, clashing with the hospitals, not wanting to pay for things that are expensive. And heaven help you if you change jobs, because most people's insurance is attached to their employment. And if you already have a condition, the new insurance company cannot cover you because it's a pre-existing condition. So there are just all of these things about how we do it. And I think private payers, people talk a lot about value-based care. There's different ways that healthcare could be funded. And I think instead of us just taking a sledgehammer to it and saying, we're just going to knock it all out, I think we actually really need to bring a scalpel to it. We learned a lot in Massachusetts. They used to call it Romney care.
Yeah.
Mitt Romney came up with that. It was transformative for the health of people in Massachusetts.
How was it transformative, and would that be a good model for the rest of the United States?
It was the sort of state level blueprint, if you will, for the Affordable Care Act. That's why I thought it was so funny when the Republicans sort of were going against affordable care just because it came out of a Democratic president. I'm like, this is what Mitt Romney did in Massachusetts, and we all hailed him and lifted him up on our shoulders. So that's the politics, instead of actually doing what's needed and standing together for what's going to actually serve the nation. So
I'm trying to think about this, because I was talking to a lot of people yesterday at this funeral about health, because these are people I've known, Deborah, now 30 years. And you got a chance to see, and it's got me just going in my mind and looking at people.
Yeah.
And I'm shutting my eyes. I'm seeing people who walked up to me, hey, Santita, how you doing? And I had to go, oh, that's right. and you could see some people, I guess, who had access to resources and some other people who did not.
Mm-hmm.
Because how you age really is tied to income in many respects.
Sure
Genetics
is.
still plays a role, but
Mm-hmm.
one of the things that concerns me, and we've been having these conversations, is how unplugging the social safety net is going to impact our health.
Mm-hmm.
And women are so vulnerable. We've got some particular issues. It's not that men are not vulnerable, Dr. Verholden, but women have particular issues. It's like even when we talk about reproductive care, when your menses commences, you no longer go to your pediatrician. It's, I don't know about your family, but that was an event in my family. Did my parents discuss it with my brothers? No. My mother told me, we have to tell your father. Ugh, I'm mortified. But she said, no, your father really doesn't understand this, but he needs to know. Okay. And my father was, oh, I'm so proud of you, love you. Daddy just is so proud you're becoming a young lady. And he punted right back to mom. He said, and that's why Daddy wants you to always be close to mom,
Yeah.
because she can teach you about womanhood. Because womanhood is its own thing. And I don't think we do that with healthcare. Um, because even the fight about reproductive rights does not take into account that we have some very real particular issues with respect to our health. And I saw that yesterday.
Yeah.
I saw that with people who I've seen now since the late 80s.
Do you know that we do medications development and testing, and we will move from preclinical to clinical studies. But mostly before medications are administered to humans, they're administered to some type of animal. And we
Mhm.
have learned a lot about how medications work, for example, around cancer in mice models.
Mhm.
Up until about 10, 15 years ago, all of the mice that were used in those studies were male.
I had heard that. Why?
They only use male mice because the menses of the female mice screw up the data. But I'm like, wait a minute, you're developing breast cancer medication.
For
And
me.
the preclinical studies are, and those women will have, be in estrus and have different, hormonal changes that are happening, even if they're not having regular periods because of perimenopause or menopause. There are still hormonal changes happening. And the medications that you're testing before you give them to me are only being tested in male mice. And then I just saw some article about one of the things that Doge is cutting. And one of the things that they've cut is some of the, it's something related to this issue. I'm going to look the article up and we're going to bring it back. Because I thought, oh, they don't know. They have to do these genetic breeding of mice so that we can have mice that, for preclinical studies, that will more closely mirror the actual human population, especially when you're talking about medications that are going to be predominantly taken by women. I mean, that's like real bias. Yeah, I know that we might as well just get it out of the way. Here's
Come
Miss
on.
India.
Oh my, look, she's beautiful. Hi, precious. She's so big.
She's a big.
Everybody, India is here. Hello.
Uh,
Hi, precious.
Hi.
Oh,
uh,
hi, precious. She's a little genius like her
my
grandma.
headset. All right, just let's get it out of the way. Say hi.
Hi, precious.
Yeah.
Oh
All
my
right.
goodness. She doesn't even know this. She is everybody's baby because we found out you were coming, India, and then we were so excited when you were coming, and
Yeah.
we're excited that you are here.
Yeah.
And I can't, she's so big.
I know. 3 years old. The time has flowed. All right, little bits. Come on. Grandma's having an important conversation. But anyway, and this is why it matters. We have to get this stuff figured out because, okay, because my granddaughter deserves access to the best of medicine, the best of prevention, all of that. The notion that we could dial the clock back and that they will go back to testing medications only in male mice because some office is going to cut out the real work that they've had to do. The mice often, okay, baby, just please wait, okay? The real work that we've done to undo some of that stuff and the bias that we had across the whole spectrum, from preclinical studies all the way to the healthcare you're getting out in community and in hospitals and like that, and the things you're not getting, to your coverage. You know, you talk about this safety net, but like you said, people have paid into these systems. And the people who haven't, we said as a country, we think access to quality, affordable healthcare is a right, not a privilege. But if you take that stuff away, we're saying something different now. So, yeah. So India inspires me to fight back and say we can't. I won't allow. I personally won't stand by and do nothing and let that happen. It doesn't even make sense economically.
Why do
There's
you say
a
that?
business case for
Because
everything.
you've been making the tie
Yep.
between our health and economics.
Yep.
What is the tie?
Well, what people don't realize is you saw this during COVID. So people went to the hospital, and I'll give you a story from she was the then health officer for Genesee County because I was living in Flint. A very, very good friend and colleague of hers wasn't feeling well, went to the emergency room, and she herself was a physician, went to the emergency room, and the emergency room was filled with COVID patients. Mostly at this stage in the virus, it was people who were frontline workers. So people who their only source of income was bagging groceries at the grocery store or driving a taxi or things like that. And we didn't have, PPE and mask and, forget about the vaccine. And that wasn't even available then, but we had other things that could have provided some protection for people, but we didn't get it into people's hands fairly and equitably. We made sure some people got it and then other people we didn't care about, right? We never talked about the person at the grocery store bagging our groceries or the Uber driver as an essential worker. We never talked about it that way until later in the COVID-19 pandemic, when we realized, we're not going to be able to get our needs met without these people showing up and doing their job. So this woman had a massive heart attack and died in the waiting room of the emergency room. So that community lost a physician, that family lost a provider, her children lost their mother, and like that, because our blind eye to the needs of people who were forced to stay solvent to work during the pandemic, or worked because they were providing a service that, but for them, we wouldn't have been able to get our groceries, or we wouldn't have been able to, even have people working in the hospitals to help take care of the people who got sick, even if it wasn't from COVID. Us turning a blind eye to people, not doing a better job at messaging and PPE, had people like my friend's friend die in the emergency room.
See, but I feel like that's COVID, that's heart attacks.
Yep.
I mean, it's strokes. It's everything. I mean, Americans. I mean, suicide. The suicides of despair. I think I'm misstating it, but people are so devastated by the economy and what they're not able to get.
Yep.
That it is depressing them, and they feel that death is the only way out. So there's all of that. And so my question then becomes, what should we be doing? Because it is unsettling to me that my mother and I were talking about this. I mean, the fact that we have fewer than 1 million hospital beds in a nation of 340 million people, it just doesn't make sense to me. That, as they say, the math ain't mathing. If you just had 1%, 3.4 million beds, okay, I could handle that. But, no wonder they were saying, people, you're right, Carol, it's frightening.
Yeah.
Because no one is getting taken care of. Some people can get into the hospital, and they're typically people who the hospital might be named after, and they have a wing, or they might be politically connected and or powerful. But the poor, the people who work there, no.
Yeah. Yeah.
So, I mean, so you tell me, I mean, because if that is what it has come down to in America, who's going to survive?
Well, so we're going to potentially, we already have these big disparities, right? And I moved away from the world of disparities, which is just differences, right? There's
Mhm.
more of this in this group, less of this in that group, and like that. And I started talking about inequities because disparities would almost imply that there's nothing we can do about it. Just some people are just not going to live as long or as healthy as others. Inequity looks more upstream and says, what are the systematic and structural drivers of the disparities that we see downstream? And that's why I say, and don't get me wrong, there are some things. If you have, for example, the BRCA gene, and I actually got to meet the woman who identified the BRCA gene. We're actually
Mhm.
on a committee together. Um, and it's not a question of if, it's a question of when, right? So genes are important. But we now understand that there's this interaction between you and your environment. And genes actually get activated or turned on and off as a function of your exposure. The field is called epigenetics, right? Genes are getting turned on and off. So that question of when, we now figured out there's actually a lot of things we can do to impact when. We can do things to impact even how your genes impact in what's called gene expression. There are things that we can do. And
Is that expensive?
now we're talking about the basics, like good nutrition, low stress living, like all of those things. These are the things. Stressors are typically the things that turn those genes on.
But see, but that's my question. You know, like when you go to the market,
Yeah,
organic food is much more expensive than
yeah.
food that's not organic.
And cost prohibitive for a
Ye-
lot of people. You
Yes.
can't afford to eat organic. It's just, you can't. And we talked about this all the time. I'm sorry, I have to make this lady a peanut butter and jelly, or she will
You,
not leave me alone.
see, I mean, so what questions should everyone, Carol, you say this is frightening. My question is, what questions should we start asking our doctors routinely? Think about that, everybody. You let me know. Do you know how to, we talked about plan your vote, vote your plan.
Yes,
I'm
that's right.
beginning to see that we need to also do that with doctors, with physicians.
Let me tell you, I do not have any encounter in the healthcare system without knowing exactly what things I'm going to ask in advance.
Hmm.
And in our childhood, we didn't have the internet. The internet, my exposure to the internet was when I was in college. I got my first email account in college, my freshman year. They said, we're moving everything from your student mailboxes to your electronic mailbox. And they gave me the address to the computer lab, and I went there and I said, where's my electronic mailbox? And they said, oh, it's on, you can get it from any one of the computers. I was in a uproar. I said, I don't want my mail on all of these computers because I didn't even understand what email was. We now have access to so much. You can just you can Google or use one of these AI tools and ask questions. And I'm not saying count on all of that information, but it at least should prompt you to say, oh, these are things that I want to at least ask my doctor about. And it's better to have them written down in advance because sometimes those encounters can go quickly. So you want to know what it is before you get there. And we've all done it. You've gone to the doctor and you left and you didn't ask about the one thing you meant to ask about. And now you got to call and you can't get another appointment. And so now you're trying to figure it out that way. I tell people when you go to the doctor, you should be prepared and you should maximize that time. When doctors do things like ask patients, and they used to do this, I was a primary caregiver for my stepdad after my mom passed, and he was 17 years her senior. And every time we would go to his primary care doctor, and many of his doctors, the first question he would ask would be, what medications are you taking? And I'm like, he don't remember what he ate for breakfast yesterday. What do you mean? What medications is he taking? We have an electronic health record, and he has an electronic health record and gets all of his care in the same system. You look on that computer and you see who's prescribed him what. How dare you ask a 70-something-year-old man who has some notable cognitive decline that you know about to list out all the medication he's taking? And even if he told you, why would you trust that? This is why we have an electronic medical record. It's all there. You look at that. You print that report before he comes in, and you go through the list and check it off with him. And you should be able to say, that's the little pink pill, and that's the white one with the number 3 on it.
Mhm.
Like that. We have to up the bar on them, to make sure that they're also giving us what we need. But we should also walk in knowing what questions we need answered and not walk out without getting those answered.
Well, and let's go there because I don't think that we know what to ask.
Yeah.
I mean, what to look for.
Hmm.
And so I would say if you could give me like a thumbnail for women and for men,
Hmm. Well, so
just
here's
give
the
me
thing.
like 3 or 4 questions or a couple of questions that I need to ask my doctor. And before going to the doctor, do you think it's a good idea to keep a diary of
Mhm.
how you felt, what you've eaten?
So it's really interesting. When something goes wrong, most people have a hard time identifying what happened that potentially could be driving the changes that they're seeing, right? So I absolutely think that's a great idea, especially if you're taking a new medication, you have a change in a medication or something like that. Noting what your behaviors are and how that's impacting your overall affect is important. So, for example, my daughter was engaged in the healthcare system. She got a new medication. She has a history of an eating disorder. Her healthcare professional knew that, and they prescribed a medication to her, which was, supposedly one of the most effective medications for the condition that she had. And no one told her that 45% of the people who take this medication gain 25 pounds within 90 days.
That happened to a friend of mine, and it blew her mind. And you know what? It also blew it. She put on more than 25 pounds, and she did it in like 5 weeks.
Yeah, Olivia was one of the people, I threw her name out. She was one of the people who had rapid weight gain. She gained probably 20, 25 pounds in a little over a month. And her appetite was insatiable. I have another good friend and colleague who is a primary care physician, internal medicine, and her uncle was taking the same medication and ended up living with her mother. Her mother had to put a padlock on the freezer, and they take a walk every night after dinner because the uncle had this rapid weight gain also. But for people who deal with this condition, it is a game changer for them and their overall well-being. But it gives some people this. A lot of people will gain weight with it. Some people gain a lot of weight really quickly. This insatiable appetite. But my thing was, no problem. Why would you all give her this medication without telling her that? It wasn't on the warning on the bottle. It wasn't anything. I Googled the medication myself, and I'm a nerd. So then I started, I go into PubMed. That's where all the research papers are. And the data was really, really clear. There are multiple, multiple, multiple published studies on this drug because it has been such a game changer, but it has this big side effect. So again, I feel like we have access, and I realize there's like so much information out there. It's kind of hard to sort and sift it out, but that's why you do a little bit of looking on your own so that you can ask the questions of your healthcare professional. And there's more than just your physician. In most offices and clinics and things like that, there's people across a continuum from paraprofessionals, physician's assistants, nurses, You go to a place like Hopkins or any one of these teaching hospitals, there's going to be medical students, residents. There's all of these people in these settings that are informed. I know. Wake up, Santita. That's what happens when you are going. You've been on the go, my friend.
You know, but you know what? I am tired.
Yes.
But also in the back of my mind, I had a profound experience going to Roberta Flack's funeral. She's someone I've known, oh my gosh, since I was 5.
Yeah.
And she's occupied a very, very big space in my life, Mary Beth. And I saw people, and I guess it's the passage of time because I'm older now. You know, when I moved into New York, I was in my early 20s.
Yeah.
And to see us all age, it's not anything that made me sad. It made me step back and look at myself. And I'm like, looking at people, because literally, I've gotten like 3 phone calls since we've been on the air from people who were there. Yeah. And I'm like, and I'm envisioning them. And like I said, some people looked really, really well. For the most part, people looked well. And then some other people, you could see they had struggled. I saw Valerie Simpson, who I've known a long time, long time, who looks, Valerie Simpson has got to be near 80 now. Mm-hmm. Mm-hmm. And she looks like she is in her 40s.
Yes.
Oh, yeah.
Yeah.
And but she's also doing things that she really, I mean, because your physical health and your mental health, all of that stuff is tied together.
Your emotional health, your spiritual health, your financial health. It's hard to be happy and healthy when you're broke. It's stressful being broke. And all of these things are related.
And that's what I'm saying. In America, it is, I'm watching and I'm looking and I'm seeing these people come to me. And what was striking to me, I'm telling you, Deborah, was seeing people who were like, oh, Santita, oh, wow, girl, you're moonwalking out of here. You look great, blah, blah, blah. And, oh, no, it's like you're aging backwards. I said, I plan to moonwalk out of here. But that's right. This was the piece. Well, it's only because emotionally I've let a lot of things go. That's what it is. But I'm watching people who I can see the impact that weight has on you. Uh-huh. I can see the impact that disappointment and sadness. Absolutely. I mean, I don't think that we look at all these things. And when I look at Americans who are now really, really looking at a system that is failing them. Mm-hmm. And I think it's what they call them, the deaths of despair that we're seeing with white people now. Things that, didn't used to kill Black people. But, what we're finding is that there's suicide by homicide.
Absolutely.
So I just, in general, I'm feeling that Americans are in trouble. I'm feeling that American women, as vulnerable as we are in trouble. We have people discussing our health care who do not understand what women experience. I mean, they don't know. And I know that with my own health journey, I saw how I went from obesity being a matter of my personal will to being a treatable disease in different parts of town. Mm-hmm. When I went to a wealthy area, what had been my personal failing was, oh, this is a treatable disease. We can work this out. And one of my girlfriends called me, one of my best friends called me, and she was in tears. I said, what's going on? She said, I just saw a picture of you. She said, you look fantastic. She said, and I never knew that all the time you had a physical issue. I said, yes. She said, no, it's not all right. Because I think about that. I think about the hard times some people gave you, and yeah, they did. And there's that. And there's so much, and I have access to a lot. But I didn't have access. I didn't start looking in that direction until I read Dr. Robert Atkins' book. Mm-hmm. Maybe 10 years before I had surgery, about 8 Yeah, 8 or 9 years before I had surgery. So there's that. But it is unsettling to me as I'm looking at these cuts, just what we're going to lose, Dr. Deborah Holden. And I'm worried about all of these. I'm worried about us because I don't think we even know the questions to ask when we go to the doctor's office. It's something that basic. Because it's
Well,
as simple
yeah.
as asking a question that I got some answers that changed my life. And
Well,
say,
so yeah, yeah. And so, obesity is a great example because like some moral failure or failure of will or things like that, even though they know that there are causes of obesity that no matter what people do, it's going to be harder for them. So
yeah,
I have an aunt who they use, she's every family has one, the skinny mini of the family, right? My aunt was the skinny mini of the family. And then as she started to age, I would say probably somewhere around her maybe mid late 40s. She's now 68.
mm.
Um, she got diagnosed with hypothyroidism.
Oh, really?
And what had happened
And
is, and
what is that? What is that?
hypothyroidism is when your thyroid doesn't produce enough hormone. And the thyroid is what controls basically how your body uses energy. And so for people who have hypothyroidism, underactive thyroid, they'll start to have the experience. I mean, and this is somebody who was a go, 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 goer, always on the go. She was the one who took the nieces and nephews to the park, took us to the roller skating rink. She was just a very active person her whole life. But her energy started to change.
Hmm.
And you don't know, right? You attribute it, well, I'm just getting older, or I'm at that stage in life as a woman,
Well, it's my
or
fault. It's my
yeah.
fault.
Well, that's you don't what you start to feel bad about is then when you aren't active, and
Yes.
then when you start to increase the weight, because then people give you feedback and they'll say things like, oh, you didn't put on a few pounds, or oh, skinny mini's gone. You know what it's like for the rest of us, not realizing, one, that that's hurtful to people, and then you internalize it, and then you think it's my fault. And then you go into the healthcare system and your doctor tells you things like, you need to move around more, you need to eat a certain way, da 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 da. And
Hmm.
they never even bother. And then, so it's literally like pushing a boulder uphill when you've got something biologically happening that's very treatable. Once they got her diagnosed, within 3 months, she was back, she was active, the weight was melting off. She was doing the same, sort of eating the same way, but how her body was able to utilize what she did eat and access it and all of that had changed because her thyroid wasn't working optimally. And that wasn't her fault.
But see, but that's what I'm saying. Instead of instead of training us to be stewards of our health, what did you and Dr. Knighton say? You have to be the CEO of your health. I'm
Yes.
being told it's like we're being policed here also.
Yep.
And so it's my fault. I'm not disciplined. All the things that I'm not doing, instead of being taught that, wait a minute, this can be the impact of maybe this is why you're the skinny mini. Or maybe this is why you're overweight, Santita. I mean, my father started looking for answers before I did because he said, you look like my mother's people. I'm like, oh, okay. He said, no, 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 no. Your great grandmother Sula was 5'9", 200 pounds. I was like, oh my God, she's huge. She said she was not. She was what they called stout and stately. She was a solid, but she was not overweight. And I don't, and he was way ahead in terms of his thinking. He said, I just want you to lose weight for number one, I want you to be healthy. He said, this to me
Yeah.
is a health issue now. And that's just weight, and that's just my experience. But a lot of people have all kinds of experiences. And women, um, and poor people are
Yeah.
dismissed.
Yep.
for holding. I only have about 3 or 4 minutes here, and I promise you, the next time I won't be as tired. But the thing is, I'm looking at someone right now, and then I got a text, and I found out that this guy he's in a cancer bout. So now and they set up a GoFundMe because he needed to get more money, and I said, this is so awful that in addition to fighting the cancer, he's got to find the money to fight it. So some people who he's worked for, and he's worked for some really big people. One guy just said, "Look, your medicine, do not worry about. I'm taking care of it. Period."
We have a study that I'm doing with a woman at Michigan State University. Who knows if the government's going to cancel it, because
Of
anything
course,
that has equity, social determinants, race, any of that stuff in it, they don't want to do. But they had never done this. There are things. You think what happened in Tuskegee? You can't even do that in a study with mice. You can't just. Let me put it this way: there's all kinds of protocols around how you treat mice and primates. So studies that involve monkeys and things like that, right? And it took a lot. But I said, do you know how many people have their cancer treatment disrupted because they lose their job, lose their health insurance, become homeless, that
Mhm.
can't pay the copay or the outstanding hospital bill. So the hospital says, you can't come back here until this bill gets paid.
That's right.
I remember with my mother, I had to take out a second mortgage because she had maxed out on her health insurance for the year. Her insurance had something like a $5 million maximum or something like that. And she was hospitalized for 180 days and she had maxed out. And they sent my mother home with an IV pole and some vancomycin in a bag and a prescription. And I had to, in a port. I mean, it was just awful. And after me doing everything I could for her, because she's maxed out on her health insurance. So she is not eligible for any more health care. It's October until January when the clock resets. I
Yeah.
took out a second mortgage on my home. I can imagine people who aren't able to do that. And so then you just disrupt your treatment. So how much money you have shouldn't be the driver over whether or not you have to suffer with cancer or can continue your treatment or like that.
But it is. That's the thing. It is. It is. It is. It is. It is. It is. And everybody, we are about to hit some walls here because the oligarchs have been trying to privatize the United States Post Office. They've wanted to put our social security monies, basically play with it and put it in and underwrite Wall Street. And if they are successful in doing that, I don't know how we're going to survive. So I want you to tell me, um, just and I'm going to bring someone on from county government to talk about how you can, how no one should be without a physician in America, particularly in Cook County, because you can. Um, nobody should be without it, because in Cook County we have a really, really robust public health care system. That having been said, Deb, I want to find out from you just what is next, because of with Medicare and Medicaid and Social Security on the chopping block, I'm so concerned. I'm so concerned. I'm so concerned about people who are not going to have access to the health care in a society that's already struggling with it.
Yeah, so I think it's really important because you got to think these are our elected officials who are making these laws. And it's also going to be our elected officials who are going to have to be the people who say, no, we're not going to allow that change to be made. We won't co-sign, or they will. And if people are okay with having their Medicare and Medicaid or their neighbors' Medicare and Medicaid cut, then okay. If you're not, then you have to use your voice. And your brother said it best. He kept, when we were on the radio last time, he just kept giving out that number. You have to call. You have to write.
202.
Yes.
224-3121-202-224-3121.
Yes. You have to let them know. And you have to let people know. And I can imagine it's a choppy time. But if your only concern is for your own reelection,
Mhm.
perhaps you're not the person for the job. Perhaps you have to take the opportunity and the time that you have to do what you know is right, to do the work, to build the kinds of uh, partnership and alliances that you need with people to make sure that the things that we know are not going to serve our communities, to say we're not going to just, you know, turn a blind eye or just take that. People have to fight back and they need to ask this stuff. I have had to make some tough decisions in my own voting over the last 10 years in Maryland. And the guy who's our governor, Wes Moore, who I think is amazing in many, many ways, there was somebody who ran before him, Anthony Brown, and the Obamas came out and endorsed him. And I just simply wanted to know what his platform was. I wanted to know where he stood on a couple of key issues, and I could never get the answer. And I said, it's the only platform here. You're going to be the first Black governor? Because that's not enough. That's not enough. Where do you stand on, violence, the distribution of resources, at the state level? I'm in Baltimore City. I'm from Prince George's County. Prince George's County and Baltimore City shouldn't get 1/24th of the prevention budget because there's 24 counties. They're bigger communities with greater needs. It should be equity based. We need the share of the pie that's relative. It's like giving a 2-year-old and a 20-year-old the same amount of food at dinner. The 2-year-old is going to have more than they need, and the 20-year-old is not going to be, you know, given enough. So if we know, I don't care about the language and all of that, but we know that the world is not fair. It's inequitable.
Mhm.
How we treat, manage, and distribute resources is unfair. It was by design. It was designed that way. And then we've done a lot of posturing and gesturing, saying, okay, we're going to try to fix this. And now we're sort of seeing, no, we don't care about that. It's all fair now, which we know it's not. You can't undo hundreds of years of classism and racism and white supremacy. You can't undo that in 50 years or maybe even 100. This went on for hundreds of years. We the people did not include Black and brown people. They were property. And so were women. It was illegal to sleep with another man's wife because it would be the equivalent of driving his truck without his permission. Like we've had a history and a legacy that we still have to do more work to undo. So in the meantime, put the sledgehammer down. I will admit there's some places where we could be more economical and efficient and maybe do have waste, but you don't solve those problems by bringing a sledgehammer and cutting out things that we know are going to have a negative impact disproportionately on people who are already marginalized. I'm not okay with that. And I don't think you should be either. So call the number and make sure you remember that when it's time to vote next
Oh,
time. And
two.
whatever is in your individual hands, your own health, I always tell people, eat the healthiest, high nutrition diet that you can afford. Eat that most nutritious diet that you can afford, right? Move your arms and legs regularly and practice good sleep hygiene. If you have access to a healthcare professional,
Mhm.
every encounter you have with that healthcare professional, have a list of the things that you want to address and talk about with them before you get there. And
You
those are
know,
things people can do right now.
well, I'm going to see as I talk to people just where they are, because I don't think that this is going to hit people until it hits them. And that's what concerns me.
Yeah.
Because when you have to go to the doctor and you don't have the means to go, oh, and we're fighting for her, for India.
Yeah. Yeah.
You know,
And her and her whole generation, they deserve better.
they deserve
We
better.
didn't do, and your father and the ones before him didn't do all
Mm.
the things that they did for us to dial it all back in one
Well,
administration
well,
or two administrations. That's crazy.
yeah, but but we see that it can happen. So let me
It
hop
can
off.
happen.
It's
Yeah.
happening. So let
Yeah.
me hop off because I got some people waiting on me on the other line. We're talking about these kids who are being And these young students who are being deported from the United States, and some American students who could be facing jail time for
Yeah.
demonstrating.
Yeah.
Wow. And they're demonstrating supporting the beleaguered Palestinian population.
Yeah.
Um, and there's that. And you know what? But this crisis creates opportunity. This is an exciting time, everybody, and we need this time, because let us not act as if things have been hunky dory, as if
Yeah.
they've been perfect. They have not been. So now the wheels are coming off, and
Yeah.
we've been riding on the rims for a long time. So now here we are.
Yeah. There you go.
Loved you, Dr. Deborah Holden.
Love you back. Have me back, and we'll unpack a little bit more and
Yeah, we
like
need to
that.
do more and more and more. I want to next time have a list of questions that we need to have for a doctor when we go, to show
Yeah.
how we and really how you interview a doctor.
Yeah. Yep.
Because some doctors, they could be great physicians, but not great for you.
Exactly. You
Think
said
about
it.
that. Love
Yeah.
you.
All right. Mwah, love you back.
Second hour of the Santita Jackson Show begins in just a moment. Click onto the other link. AM 950 Radio, the voice of progressive Minnesota.